Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Hello, everyone. I am really excited and honored to introduce the listeners to Lee Grossman, Chief Executive Officer of the Orthopaedic Research and Education Foundation, also called OREF, a charitable 501c3 committed to improving patients' lives by funding musculoskeletal research that advances clinical practice. Hi, Lee.
Hi, Marty. It's great to be here, and thank you for the opportunity to be on your program.
Always a treat to talk with you. Well, Lee, can you talk us through the evolution of musculoskeletal research and changes you've seen since you've been in the industry?
Well, it's a long time that I've been in the industry. I actually spent over 2 decades in the orthopedic industry before getting into the nonprofit sector, which I've done for about the last 15 years. So over the course of that time, I've obviously seen a lot of changes. We all have. And those changes that have happened to the practice of orthopedics have been, for the most part, generated by musculoskeletal research. I guess the area that is most interesting to us right now in terms of where it's headed with research is kind of the challenges that musculoskeletal research have and the big disconnect between the impact of musculoskeletal disease and the amount of funding that is available. There's some challenges that we are dealing with here with MSK research, which I think are among the biggest changes that we're seeing right now.
What do our patients today have that they may or may not have been able to get as soon as they did without research?
If we look at the history of OREF, we were founded in 1955. We funded approximately 4,700 grants over the course of these past 69, 70 years. And a lot of the innovation from the research side that's happened in orthopedics was a result of OREF has funded over the years. For example, we funded some of the initial science that was related to the work that Bill Harris did with osteolysis. We were the first to fund the research in compartment syndrome, the first to fund the principles that later became what we are currently using today with bone banks. Stem cells for regeneration of musculoskeletal tissue. A lot of what we've funded over the years that patients are now getting exposed to and have access to were first funded by OREF, and the list goes on. There's much of what is used by orthopedic surgeons today in their clinical practice that they get reimbursed for. There's the CPT codes that they're using are a result of the types of research that we have funded over the many years. I'd say that right now there's been a heavy emphasis on how do we do the surgeries faster? How do we shorten the hospital stays? There's been certainly a move towards ambulatory surgery centers. There's also been a great deal of emphasis that's being brought forward on what I'll refer to as the whole concept in orthopedics and access to greater patient data as a result of that. And also looking now, I'd say there's been a major emphasis over the last few years to get more into what the patient reported outcome measures are and patient satisfaction. So that keeps evolving. One of the things that I will say is that there's still so much innovation that can be and should be done in orthopedics. I attend many conferences throughout the year, easily 2 to 3 a month. And typically when I run into somebody I haven't met before and we get into a conversation about musculoskeletal research, I ask them, the surgeon, what do you think is innovation that you've experienced over the last few years? And it is disheartening to a degree to not hear a lot. Again, some of these things that I pointed out about the move to ambulatory centers, digitalization, et cetera, are what we're looking at in innovation. Certainly implant design has changed over the years and has been improved upon, but a lot of the deep science and etiology of disease factors really have not been developed to the degree that they are. And these are some of the issues that OREF is focusing its attention on and bringing to the forefront so they can be addressed and we can improve patient outcomes.
Okay, so in layman's terms, I'm a patient, I'm listening to this. I probably didn't understand 50% of the brilliant things that you just said. Compartment syndrome. If I'm a patient and I don't know what research has done to ensure that I'm successfully walking out with limbs and muscles alive and intact, talk me through about why it was so necessary to study compartment syndrome and what that means to a patient when they go into the hospital.
Well, using that as an example, the person that's been in the forefront of that, or developing that technology many years ago, was Dr. Fred Mattson. Prior to his initial research, there wasn't really enough to measure compartment syndrome, the pressure that was being built up in a limb, and if it wasn't addressed properly, then that limb, it could result in muscular or vascular damage, or potentially even the loss of that limb. And so here was a gentleman that had an idea, saw a problem, decided, well, let me figure out a way that I can measure this. And he did that very effectively and developed the degrees that a doctor would look at when looking at the measuring device, that if it showed a certain amount of pressure buildup, that some sort of intervention like a fasciotomy had to be undertaken to relieve the pressure and therefore save the limb.
So from a patient lens, if, how does it go from a doctor having an idea about a better way to do something, or even just wanting to see if there could be a better way to do something, to where they get a grant, to where they do a study, and to where it impacts me as the patient coming in and wanting to make sure that my limb is salvaged?
It really starts out with looking at what's currently being done and saying, there's a need here. We probably do this a little bit better, a little bit different, save some time, save costs, get the patient up and out earlier, reduce infection, etc. And then just focusing on those notions of perhaps how we can improve it, go about the process of developing the idea, going about getting some funding for that idea to develop it so that you can do an adequate, rigorous study to prove the idea, and then hopefully then it can get into clinical practice.
I know earlier you talked about, there's a lot being done to digitize things, looking at patient reported outcomes and patient satisfaction scores. Can you talk about the shift in the way that studies are being run these days?
Well, I'd say there's been a shift lately in the volume in some areas. For example, in pain management, we're seeing there's more attention being paid to that, specifically trying to reduce the dependency on opioids, for example. There's been a major shift in research ideas towards biologics and regenerative medicine, because there is a lot of hope, and people's beliefs that's the future of orthopedics, is if we can be much more engaged in that. One of the areas that OREF is supporting tremendously is the development of team science, and that's where various disciplines come together to address a specific problem. So instead of just having a clinical researcher or clinician who's interested in research looking at how are we going to address osteoarthritis, well, we'll bring in the basic scientists as well, maybe cellular scientists or somebody that's looking at anti-aging or senescence cells, to work together as a team to address these problems. So that's some of the areas where we're seeing shifts. For us at OREF, we've been trying to focus our attention more towards the future of where this MSK research should be going. And we look at it in a lot of different areas. We're trying to push for more research in the area of genomics, microbiome, personalized medicine, biologics, as I said before, into pharmaceuticals. Also looking at osteoporosis treatments. And it doesn't even, some of what our research also goes beyond just the classic medical research. We're also looking at societal issues, like how can we improve accessibility and equity in the treatment of orthopedics. So these are obviously some of the areas that we're looking at. I would generalize by saying that we're looking at how to better predict, prevent, and do earlier intervention into MSK issues.
So it sounds like this is kind of that perfect marriage of A, we're in the technological era, and B, value-based care where they're trying to do interventions. I always looked at research as setting the trends. Are you seeing it a little bit more reactive now?
Yeah, I would say that it's reactive. And what you pointed out before, it shouldn't be that way. It should be moving in a progressive way. The reason I'm saying it's reactive is because of the lack of funding and in MSK. MSK dominates healthcare. And when I say that in terms of cost and in terms of procedure, nothing comes close to MSK. And as a combined unit, MSK represents about 5% of the country's GDP in terms of the treatment of pain, healthcare costs, and a number of other factors. So there's this tremendous burden of disease that MSK has out there, and orthopedic surgeons have done an amazing job of treating that. This burden of care is continuing to grow every year. So you have that on one side where you have this incredible global issue of the burden of healthcare that is a result of MSK, which results in many other health conditions, such as if somebody is limited in their mobility, their chances of developing diabetes and obesity, cardiovascular disease, and depression go way up. And there are many studies out there showing that the burden of disease caused by MSK is a contributor to these other health conditions. So you have that on one side. On the other side, you have MSK funding is very, very low from the federal government and others. There have been some studies that have shown that osteoarthritis and MSK research doesn't even crack the top 40 in funding levels at NIH, for example. Another area is the fact that big data has become huge. As I said, the MSK issues dominate healthcare. So there's a lot of data out there, and the big data companies are now getting into MSK and trying to develop ways through digitalization, through AI and other methods to capture that data. And so what this will be producing is algorithms that may drive decisions in orthopedics that really have not shown in any way, because the research is not being done to really see if those algorithms, if the data that they're collecting is improving patient outcomes. And that's really where the emphasis is. Also, if algorithms are being developed and a lot of the decision making is being driven by big data, where does the surgeon play a role then? It would seem like that role might be diminished if they're allowing other technologies to kind of make those decisions. So that's another big concern that we have. Just this lack of research funding limits the opportunities, and it creates silos in the research community where it's harder to do this type of team science that I described before, and to develop large, multi-centered, well-funded studies so that you can address some of these bigger issues, such as trying to find, for example, better treatments, earlier treatments, the etiology of osteoarthritis, just as one example.
How do we, justify quality of life versus funding things that are life or death situation?
Well, that's a wonderful question. And it seems like a question that hasn't been properly addressed over the years. Because if you look at MSK issues, it is life and death. It may not be the emergent issues that you would have for somebody who has a major cardiovascular event, but it still drives a lot of our quality of life. Again, some of these studies that have been done recently looking at this burden of disease have demonstrated that it's among the leading cause of years lived with a disability, for example. And it's the third leading cause in terms of prevalence and disability adjusted life years, which essentially says you have an MSK injury, your life is going to be shortened. And as I said before, it's a precursor for these other issues that come up because you lack mobility. And it does create the opportunity or a greater percentage of developing depression, diabetes, obesity, etc. So one of the ways that this also plays into it is, and you ask, how do we go about this? Well, I think it's very important that to a degree, we look at addressing this issue of MSK funding from a patient advocacy perspective. And what I mean by that is that we do involve more patient advocates and people that are affected in the discussion so that they can, to a degree, even lead the charge that we have to take to get more federal funding and governmental funding for MSK research. Part of that also is that when I look at funders that are out there, for example, industry, well, industry has its own needs in addressing how they want to approach research. But there's also a tremendous need to have these larger studies that are independent, unbiased, and rigorously peer-reviewed, because without that, the credibility of the MSK research that is being done begins to fall off. And if we lose credibility in the MSK research side of it, the field, the clinical side of it is going to also lose its reputation and its credibility.
I can literally see the nodding going on from our academic listeners out there. Well, as we're wrapping this up, you shared some really exciting news with me the last time I got to see you about this venture capital fund. Can you share a little bit about that?
We made the public announcement on it on May 21st that we have launched a venture fund, and we're limiting the fund at this point to OREF grantees, people that have received a grant from us and have completed that research. We don't want to include people that were considering for research or currently in the research part of their grant. We're doing this kind of as an accelerator mode, and what that means is that for those that are chosen to be part of this VC, we'll develop a full business plan for them, and then they'll have the opportunity to pitch the investors that we have, and then the investors will make a decision on what they'll take forward. But for those that have gotten to that point of pitching, they will, at a minimum, receive a full business plan from professionals who have worked with them so they can take their ideas and their innovation forward. There's also other programs that we're working on right now that I hope we will be able to announce later in the year. One is a way to provide investigators with increased ways to test, create, and disseminate the research information so that it's more on a global scale. And we're also looking at creating a mechanism for private practices to compile and report the real-world evidence and their patient outcomes.
That is really exciting, and I can't wait to hear who gets picked and who gets moved forward in that VC process. Well, thank you again, Lee. This has been extremely informative. We really appreciate you just unpacking with us the need for musculoskeletal research, because it probably, to your point, every single one of us is going to need some kind of MSK intervention at some point in our life. And we just really don't think about it. For our listeners who would like to connect with Lee and learn more about the OREF, please check out his bio in the show notes. Thanks for listening to Connect to Develop. You can find more interviews and Marney's Minutes on my YouTube channel at Marney Reid Presents.